GLP-1 receptor agonists are medications used for weight loss and type 2 diabetes. They help people feel full sooner, eat less, and improve blood sugar control. But while these medications are effective, many people worry about stomach side effects. So let's talk about what actually causes those symptoms and how to manage them so you can stay on track with treatment. Welcome to Science My Health, your channel for health and research information. The most common side effects of GLP-1 medicines are gastrointestinal, meaning they affect the stomach and intestines. These include nausea, diarrhea, vomiting, and constipation. In clinical trials, nausea was reported in about 15 to 30% of people, diarrhea in about 10 to 15%, and vomiting in about 5 to 10%. Constipation is also common, especially when these medications are used for obesity treatment. Why does this happen? GLP-1 medicines slow down how quickly food leaves the stomach. That helps reduce appetite and control blood sugar. But it can also create a feeling of fullness, nausea, or changes in bowel habits. The good news is that these side effects are usually mild, happen most often when starting the medication or increasing the dose, and tend to improve over time. Experts recommend a simple framework for managing these symptoms, often called the 3 E's: education, escalation, and effective management. First is education. Before starting treatment, it is important to know what to expect. Most stomach symptoms are temporary and not a sign that something is wrong. Eating smaller meals, stopping when you feel full, and avoiding high-fat or spicy foods, especially early in treatment, can make a big difference. Limiting alcohol and fizzy drinks can also help. For constipation, increasing water and fiber intake may improve symptoms. Your healthcare provider should also ask about any existing digestive conditions before starting treatment. GLP-1 medications are usually avoided in people with severe stomach emptying problems, such as gastroparesis. The second step is escalation, which means slowly increasing the dose. These medications are started at a low dose and gradually increased. This process is called titration. Slow dose increases help reduce stomach side effects. In real-world practice, doctors may slow down dose increases even more if symptoms appear. Reaching the full dose a little more slowly can improve comfort and help patients stay on treatment. The third step is effective management if symptoms occur. For mild nausea or stomach upset, start with dietary changes and hydration. If you have constipation, ask your provider about whether you should take a fiber supplement. Your diet could also play a role, so eating fruits and vegetables that naturally contain fiber can minimize constipation. If vomiting occurs, staying hydrated is very important. Severe or persistent vomiting, especially with dizziness or confusion, requires medical attention. Your provider should also make sure something else is not causing the symptoms. Acid reflux, also known as GERD, can worsen during treatment and may need temporary treatment. Inform your provider about all other medications, including OTCs that you are taking. Persistent, severe abdominal pain, especially if it spreads to the back, could be a sign of pancreatitis. In that case, the medication should be stopped and urgent medical evaluation is needed. Rapid weight loss can also increase the risk of gallstones. So if you have new upper abdominal pain, it should be evaluated. If symptoms continue despite adjustments, lowering the dose may help. In some cases, switching to a different GLP-1 medication may be reasonable because individual drugs in this class can affect people differently. If side effects remain severe despite all efforts, stopping the medication and considering another treatment option may be necessary. The bottom line is this: stomach side effects with GLP-1 medications are common, but they are usually mild and temporary. With proper education, slow dose increases, and early management of symptoms, most people can continue treatment successfully. Understanding what to expect and knowing when to speak with your healthcare provider can make all the difference in staying consistent and reaching your health goals. Like this video if you learned something new, and subscribe to Science My Health for more health research news.